Hello and welcome to another episode of the Health Notebook. Today we have Dr. Khan in the studio and we'll be exploring some ear, nose and throat conditions. Dr. Khan, welcome to the studio.
Thanks for having me. It's a pleasure to be here.
Dr. Khan, can you maybe just tell us a little bit about yourself?
So I'm a medical officer currently working in the ear, nose and throat department of a government hospital. I work one-on-one with a specialist, the ear, nose and throat specialist, and that's where I am right now.
Okay, so in terms of your education and your academics, I mean, what have you done so far?
So I went to high school at South Peninsula High School in Deep River. From there I got accepted into Stellenbosch Medical School and I did my medical degree over there. Afterwards, I did my internship and my community service, and once that was over, I was qualified medical officer, and now I'm working in the ear, nose and throat department.
Okay, so just to explain to the viewers, I mean, ear, nose and throat, okay, that's a separate speciality, but how, I mean, just to inform the viewers, for example, can you just maybe give them a few medical conditions that you would deal with?
Sure. So ear, nose and throat department is a specialist field. It falls under one of the surgical disciplines. So usually we'll get referrals from general practitioners to send patients to us. And usually that's when there's illnesses that need to be managed further beyond the scope of what a general practitioner generally can do. And that various illnesses like external ear infections, internal ear infections, damage to the ear structure for the ear side. For the nose, there can be various conditions like sinusitis that need further management, polyps, and septal deviations, constant blocked nose, constant runny nose. And for the throat, we see lots of tonsillitis, tonsils, hoarseness, and so on.
So just to inform the viewers, it's not just managing the person from a medical perspective and providing medication, but it's also those surgical procedures that
Absolutely.
You do. Just highlight one or two.
So typical surgical procedures that we do, we often do tonsillectomies, adenoidectomies. From the nose, we do polypectomies, we do septoplasties where we straighten out the septum, and then we do many ear ops as well. I know you mentioned septoplasty, so just to explain to the viewers, what is a septoplasty? So in the middle of your nose, you have a partition that's called the septum that separates your nose into a right and a left nostril. And often in many patients, they have constant blocked nose due to one side being narrower than the other. Could be a bony or mechanical abnormality that causes the one side to be more narrow than the other. When we do a septoplasty, we straighten out that septum and we make as much as we can, we make the two nostrils equal in size and thereby improve our patient's breathing.
Okay. Now, you've mentioned that you also perform some surgical procedures. Can you just explain to the viewers, okay, now I've got maybe a tonsillitis and further down the line you need to perform a tonsillectomy. So in terms of working the patient up, what needs to be done and sometimes what are the contraindications so that, I mean, what I actually mean by contraindications is those patients that are not at that moment in time, they are not appropriately prepared to go for surgery. So if you can just explain to the viewers the concept of making sure that you're fit to be operated on.
Okay. So usually, at least for the patient side, the patient will first see a general practitioner with the complaints of tonsillitis. That patient would then be referred after possibly 5 episodes or more, or several episodes where it's causing quite a bit of problem for the patient, to an ENT specialist. Once they reach the specialist side, the specialist will make a decision on whether you need the operation or not after examining the tonsils and making sure that that you have been having tonsillitis and not something like a sore throat or other reasons for it. If the specialist has decided that you need an operation and that the operation will improve the quality of your life, we'll go ahead and book an operation for you. When booking an operation, we need to make sure that there's no contraindications to the operation, for example, bleeding disorders or mechanical abnormalities. Because
so when you mean bleeding disorders, I mean, just can you explain to the...
One of the risk factors for a tonsillectomy is bleeding. And to make sure that we can go ahead with the procedure, we have to ensure that when we do the procedure, you won't be at more risk for the bleeding. And risk factors for that is if you have a familial family disorder where you have increased risk of bleeding. If you're on medication that can make you bleed more is also another reason that the operation may not be the right operation for you.
So when you mean the medication that can make you bleed more. Can you just explain to the viewers some of those medications?
So some of those medications are, the most common one is warfarin, and then there's Dispirin. And then if you're someone who regularly takes garlic tablets have also been shown to increase your bleeding time and can be at a risk for procedure.
And this obviously now needs to be disclosed to the ENT specialist. Besides your conventional medication, the patient also needs to inform them about the normal over-the-counter, maybe herbal medications that can also interfere with the process.
Absolutely. So it's the more information your surgeon has before the op, the more planning you can do to ensure that you have a better operation.
Okay. Now, in terms of respiratory tract infections, is that and how does that affect the surgery as well?
So once your operation is booked, your surgeon will give you a date. So you won't get a date, you won't get operated immediately on the day you go and visit the ENT specialist for the first time. So your surgeon will give a date and make sure that you are in optimum health for the operation. Prior to the operation, you'll be assessed from a anaesthetist as well, that's the doctor that's going to manage your pain and keep you asleep and unaware for the duration of the surgery. And the anaesthetist generally ensures that you're healthy enough and fit and healthy for the operation. Often when a person that's about to have an operation has a chest infection where there's productive cough and you're feeling generally unwell and there's fevers, you won't be fit for a surgery, and your surgery then has a higher risk. And in that case, often they'll postpone the operation or cancel the operation for that time.
Okay, so now you've prepared the patient, but going just before that, when you consult the patient, obviously you'll examine the patient, the ear, nose or throat, depending on the medical condition. But what other tests would you do? I know there are certain medical equipment that you have maybe to visualize inside the nose. So can you just give the viewers that it's not just examining, but you make use of other approaches to actually pinpoint the cause of the illness as well?
So again, it depends on the type of illness you're coming for, what type of equipment will be used. If we continue with the theme of tonsillectomy and adenoidectomy, the ENT specialist generally looks in the throat with a headlamp, keeping both hands free, whereas often a GP will have a torch in one hand and a spatula in the other hand. The specialist generally has a headlamp where you can look clearly into the throat, sometimes even two spatulas in the mouth to make sure they get optimum visualization of the back of your throat and to see what the tonsils look like. So other equipment that the ENT specialist often has at his disposal is a flexoscope, which we use to look in the nose and down the back of the throat. It's a tiny little camera. They'll probably spray your nose before to take the feeling away, and then you put the camera through the nose. We were able to look at the nose, the back of the throat, up until the voice box with the flexoscope. It's a tiny little camera with a light on the inside.
So that allows you to look at the throat to see if there's anything abnormal, any swellings, any growths or anything like that.
And up until the voice box, where we can actually see if there's a cause for hoarseness, what the concern will be. We can visualize the actual vocal cords to see that. Also.
And in terms of other investigations?
So other investigation and equipment that we have, we also in the ENT department have a very high quality microscope to look inside the ear, and from there we can look deep into the external ear and see if there's any abnormalities in the external ear or along the eardrum itself.
Okay, now we're going to be we'll be touching on some of the common ear, nose and throat problems. We'll start off in terms of a tonsillitis. Can you just explain to the viewers what is tonsillitis?
So tonsillitis is infection of the tonsils, and the tonsils are lymph tissue that sits sort of at the back of your throat, just behind the tongue, on either side of the back of the throat.
So just to inform the viewers, what does the lymph tissue actually do?
So lymph tissue acts as a site for where to put it in the simplest way, where the immune system or the body system fights any incoming bacteria or virus or anything that can cause infection to the body. And this tissue often swells up as it fights the infection and learns from the bacteria how to fight further infections in the future.
Now, in terms of a tonsillitis, what would be the signs and the symptoms?
So signs and symptoms of tonsillitis, it's often associated with fever, pain and difficulty eating in the back of the throat. So often people have difficulty swallowing. It may be accompanied by a foul odor of the mouth, so your breath may smell very foul, and often people also complain of a sore throat.
Okay. Now, in terms of the presenting signs and symptoms with a child compared to an adult, is there any differentiation in that?
Generally, adults feel a tonsillitis a lot worse than children. So adults will, most upper respiratory tract infection won't put an adult out of work for a few days. So common colds, flu, yes, that's 1 or 2 days, but when it comes to tonsillitis, the adult will have fever, will actually be very, very unwell, and often take bed rest for 2 days at least with a proper tonsillitis.
Okay, there is this common idea that it only happens to young people, or young people can only develop tonsillitis. So can you just explain to the viewers that rationale as well?
It's definitely more common in younger people and in young children, mostly because children tend to put lots of different things in their mouths and the immune system is not yet fully developed. As we grow older, often we speak about children outgrowing their tonsillitis as they hit the age of about 7, 8 years old, and many of their tonsils then shrink and perform less of a role in the body and then totally disappear. Well, not totally disappear, but they're not visible anymore when you examine the back of the throat.
Okay, now you're seeing a patient that has a possible tonsillitis. You've mentioned about fever and things like that. So when you actually visualize in the throat, what would you expect to find?
So when you look at the back of the throat, then you'll see enlarged tonsils, and you'll sometimes see that they have crypts with debris coming out of them, and they can actually have pus draining from the tonsils themselves.
I mean, it's the opening at the back, and you see these two large
areas of tissue with white dots and spots on them and stuff, and sometimes pus even running from there.
Okay. Now, in terms of the medical treatment, you're seeing a patient with a tonsillitis. What's your management plan?
So the usual cause will be bacterial, and you'll get a antibiotic from your GP if that is indeed the case. Sometimes it's just a viral tonsillitis and it doesn't have the typical look of a bacterial tonsillitis, and symptomatic treatment will be much better.
Okay, so when you mean the symptomatic treatment, do you mean something for pain and fever and
Absolutely.
things?
So tablets for pain, tablets for fever, and sometimes a mouthwash also helps the patients just to help with the pain.
So now the medical practitioner or the GP has given you the treatment, the antibiotic. After how many days can you expect to improve?
So antibiotic takes about 3 days to really kick in. So you won't feel immediately better on the first or the second day, but I like to give patients, to warn patients that it may be about 3 days before things start feeling better in the back of the throat.
Now let's assume I don't see any improvement, or the patient doesn't see any improvement after 4 or 5 days. I mean, what's the next course of action, or what should be done then?
So sometimes a viral infection can keep the symptoms there longer, and sometimes it takes about 7 to 10 days for a viral infection to clear up. If it's a bacterial infection that's not getting better, you may need a different antibiotic, or you may need to see the specialist, then need a specialist referral sooner.
Okay, now after, I know you can get different amounts or different numbers of or episodes of a tonsillitis. After how many episodes of a tonsillitis would you require then to have a tonsillectomy?
So there's various studies and guidelines around the world. I know in America they do 8 episodes or more before even thinking that tonsillectomy will be necessary. In our clinic we work on 5 episodes of tonsillitis or more before considering a tonsillectomy.
Okay. So we're speaking about now a tonsillectomy that's related somehow indirectly to a tonsillitis. Yeah. Now can you explain to the viewers what is a tonsillectomy?
So tonsillectomy is a surgical procedure to remove the tonsils, and it's a procedure that the ENT specialist will do. It's a painful procedure. Recovery period, we usually give our patients 10 days to recovery period, 10 days to 2 weeks, and lots of good pain management during the time.
So you would obviously then do the pre-workup, which you've mentioned earlier in the show, and then you'll actually then do the surgery. So what do you actually do in the actual surgery? What is the process?
So in the actual surgery, the patient is fully asleep and unaware of what's going on, and obviously while you're asleep you're pain-free, so all that is managed by the anaesthetist. You have to be intubated for the operation, which means the anaesthetist will put a pipe in the back of the throat and into the lungs where you can breathe freely while you're having the op. The ENT specialist will then remove the tonsils. In the clinic where I work, we remove the tonsils with bipolar electrocautery. So that's electricity that moves through 2, I suppose one can call it tongues, and we can burn the area to stop any bleeding and separate the tonsils from the tonsillar bed in the back of the throat. Okay. And we remove from there.
Okay. And would you remove any other areas of tissue as well, or
So when we do a tonsillectomy, we only remove the tonsils. Often in young kids, especially those younger than 8, we do a procedure alongside the tonsillectomy called an adenoidectomy, and the two together are called the adenotonsillectomy, where we remove tissue at the back of the nose as well. So just a little bit higher up in the back of the throat, but more along the back of the nose.
Now, in terms of removing the adenoids as well, what's the background to that?
So the background to that is a child who has a constant runny nose, blocked nose, and also constant ear infections. So if you have a child who has constant middle ear infections, we also use that as an indication to remove adenoids for the child.
Okay. Now the patient has had the surgery done. He's sent back to the ward, and now he's discharged as well. What are some of the warning signs, that one should actually be aware of after the tonsillectomy?
So once we discharge a patient after tonsillectomy, we always warn them about bleeding. That's the first and foremost highest risk in the operation. And there's a high risk for bleeding within the first 8 hours of the surgery, and then after that in the first 10 days of the surgery, after the surgery as well. The way we warn our patients is that if there's any fresh red blood coming from your mouth, if you're coughing and blood is coming from the mouth, or if you start vomiting blood, you need to go back to a hospital immediately.
Okay. Now, there are other medical conditions that can also sort of mimic a tonsillitis. Can you maybe just highlight some of those other medical conditions?
So sometimes patients with a infection at the back of the throat, a strep throat, or sometimes a flu, or even a cold, can complain of sore throat, and often they get treated as a tonsillitis when they complain of sore throat.
Okay. Now, I just want to touch on two things here. The first thing, in terms of an upper respiratory tract infection or a cold or flu, I just want to touch a little bit on that just to explain, or just to make the viewers aware, what is the difference between a cold and a flu?
Okay. So that's a bit of a tricky one to say. So a flu is generally associated with more body aches and pains as well as fever, whereas a cold is more associated with runny and snotty nose without the body aches.
Okay. And I know most people are under the impression that they both need antibiotics. So can you just also differentiate it in terms of causes, which is number one, and in terms of, so if you could just sort of differentiate it in terms of causes and in terms of medical management then.
So both the cold and the flu, neither of those need antibiotics for you to feel better. Antibiotics don't treat either of those because they're both caused by viruses. And antibiotics have no effect against viruses. So when you have a cold or flu, the best management is supportive management, which means supporting the symptoms. So fluids to help you feel better, medication for fever, and things to dry up the nose will make you feel better much faster than any antibiotic. And in the case of flu, bed rest is quite important. So 1 to 2 days of bed rest is very important in the flu. Okay.
And what are some of the complications associated with these upper respiratory tract infections?
So they can progress, so they can get much worse, and especially if you're having a lot of mucus and you're not using anything to dry the mucus up, and they can actually progress to make the infection worse, cause either sinusitis or sometimes even cause infection of the chest and a bronchitis or so.
There's two important questions which actually I forgot to ask you about, and the first is, what is the additional advice that you would advise those patients going for a tonsillectomy to take or to be aware of after a tonsillectomy?
So once you've had your tonsillectomy, besides the warning signs where you need to get immediately back to hospital, as I mentioned earlier, it's also very important to eat normal food. So often people come with the idea that they must just eat soft foods and give the throat a break but it's been proven that eating food that you must chew, and chewing actually improves your healing period. So you'll heal faster with less chance of secondary infection and a secondary bleed, and you'll actually do a lot better, quicker if you eat normal food. So the sooner you can eat normal, the sooner you'll do better. Okay.
Now, in terms of indications, again, I know you've mentioned previously about you need to have 5 episodes before there is a consideration for a tonsillectomy. So what are the other indications for a tonsillectomy?
So other indications for tonsillectomy would be if you've had a peritonsillar abscess or quinsy,
So what is a in simple terms to explain to the viewer?
So it would be extremely painful at the back of your throat, and when the doctor looks inside of your throat, you'll actually see that one tonsil has a big swelling behind it, and that's often just a pus collection, and that can cause pain, and that has a chance for repeating itself again. So we often do tonsillectomies for our patients to remove the tonsil so that they don't have another episode of that, because it can be life-threatening. If it swells up quite a bit, it can cause that you can't open your mouth and that you cannot breathe. So that can be a life-threatening illness.
So besides that, is there any other indications?
Other indications would be a persistently asymmetrically enlarged tonsil. So that means if one tonsil is enlarged more than the other for a long period of time without resolving, we would remove that, because there's a risk that that may be a tonsillar cancer. And the other indication would be tonsillar stones. So if you often have one white patch on your tonsil, you have an episode where your mouth smells extremely foul while this is happening, eventually it passes and then it resolves, that could be a tonsillar stone, which also has a chance of recurring. And the only way to really stop that from happening is to have a tonsillectomy.
Okay, we've almost reached the end of the show. So in terms of a take-home message for the viewers, what would your take-home message be?
So if you've had recurrent episodes of tonsillitis, especially those that don't seem to be getting better despite antibiotics, it might be worth your time discussing with your GP a referral to an ENT specialist to have a look at whether tonsillectomy will be indicated and whether it would improve the quality of life if you have a tonsillectomy. Okay.
Dr. Khan, it's been a great pleasure having you on the show. We look forward to actually speaking to you again, and we'll be looking at nosebleeds and ear infections in the future. So thank you very much for being on the show.
Okay, thank you very much for having me.
So there you have it. We've heard from Dr. Khan exactly what a tonsillitis is and what a tonsillectomy is. And if you are experiencing any of these signs and symptoms that Dr. Khan has mentioned, be sure to mention it to your general practitioner so that he can review it and take the appropriate action. So once again, thank you very much for watching. Stay tuned for another episode, same time, same place, next week.